13 Techniques for Cognitive Behavioral Therapy. Cognitive behavioral therapy is a well-established treatment for psychological problems. We examine some cognitive behavioral therapy techniques. The main techniques of cognitive behavioral therapy (CBT) consist of a set of strategies that are both effective and practical in any psychologist's daily routine. Thanks to this well-established approach, it is actually possible to deal with everything from depressive disorders, addiction, relationship problems, and the most serious mental disorders. It's actually a great resource. A study published in Frontiers in Psychiatry defines CBT as the gold standard of psychotherapy. This is largely due to the larger number of studies that support it. Knowing its mechanisms and the way it works will give us a clearer vision of this particular therapy. Let's take a closer look at it. Science claims that cognitive behavioral therapy was the first model with the strictest criteria for approval of its effectiveness and usefulness. Cognitive behavioral therapy. In the 1960s, psychotherapist Aaron Beck developed CBT. From then on, the technique became unstoppable. In fact, it served as the basis for the treatment of many different psychiatric disorders. This method, based on conversation focused on the client's problem, was an advance compared to more classical models such as psychoanalysis. A CBT is based on the following principles. Psychological problems stem from dysfunctional and inappropriate ways of thinking. We can all learn new strategies to develop healthier mental and behavioral approaches. Suffering is triggered by automatic mental patterns that we have learned and reinforced on a daily basis. It focuses on the following objectives. Understanding the client's behavior and motivation. To develop a valid sense of self-confidence in the client. To provide new tools and useful coping strategies. To detect thought distortions and irrational thought patterns. To enable the client to become his own therapist. In contrast to psychoanalysis, the past is not particularly relevant to CBT. It is considered more important to offer the client tools to deal with his sufferings and problems here and now. Primary techniques of cognitive behavioral therapy. A CBT is based on the fact that the individual's way of thinking affects his or her feelings and behavior. Therefore, the focus is on intervening in the cognitive mechanisms that, according to CBT, form the basis of psychological disorders. Based on this premise, a whole series of techniques are developed and used. They are as follows. 1. Cognitive restructuring. Cognitive restructuring is a psychological process that enables the client to identify and change his negative or dysfunctional thought patterns. In this way, his or her negative or distorted, automatic reasoning, of which he or she is not aware, is challenged. This is the kind of behavior that leads to emotional distress and maladaptive behavior. This is one of the most widely used and effective CBT techniques. An analysis carried out at Stanford University, USA, highlights its usefulness in the treatment of fear. 2. Exposure therapy. The goal of exposure therapy is to help clients face their fears and anxieties and overcome them by gradually exposing them to situations or stimuli that cause discomfort. In recent years, exposure therapy has benefited from virtual reality. It starts with an analysis to understand the mechanisms and thoughts that reinforce the fear or phobia. The goal is to break the cycle of avoidance and enable the client to manage his anxiety more effectively. In each session, the psychologist gradually guides the client so that he or she can gradually face his or her worries and fears. 3. Systematic desensitization. Systematic desensitization is one of the important techniques of cognitive behavioral therapy. This strategy was developed by psychologist Joseph Wolpe. It is similar to the exposure method, but it is based on a specific premise. In systematic Desensitization, anxiety, and relaxation cannot actually exist at the same time. Therefore, one must induce a relaxation response in clients before exposing them to their fears. From this starting point, the psychologist follows the next therapeutic steps, creating a hierarchy of the client's fears. Our training in relaxation techniques. Imaginary exposure. Exposure in reality. A study published in the American Journal of Pharmaceutical Education highlights its effectiveness in treating exam anxiety in students. 4. Theory of records and thoughts. Techniques for cognitive behavioral therapy. In CBT, clients always have homework to do. Writing down in a journal what they think and what they feel facilitates the therapeutic process. Furthermore, it helps them become aware of their mental narratives and how these affect their mood and behavior. 5. Activity programming and behavioral activation. Another of the techniques used in cognitive behavioral therapy is behavioral activation, activity programming. These strategies are important for clients struggling with depression. They are also useful for people who are addicted or who have self-destructive behavior patterns. The main purpose of this technique is to promote healthier behavior in the client. New activities are planned which create changes in his or her well-being and mental focus. 6. Modeling techniques. Modeling techniques are used to help individuals develop new skills and behaviors through observation. It is always powerful for a human being to see someone perform a healthy and beneficial action. It allows the client to learn really useful tools for change and well-being. Modeling techniques are as follows. Verbal, through instructions. Symbolic, through videos and films. Alive, to see someone in reality to imitate. Self-reinforcement. The person doing the modeling reinforces the observer's correct behavior. 7. Stress inoculation. Techniques for cognitive behavioral therapy. The stress inoculation technique was founded by Donald Meechenbaum in the 1970s. The purpose is to help people deal with stressful situations. A study conducted by Isfahan University of Medical Sciences, Iran, emphasizes that it is effective in reducing stress in cancer patients. This technique is based on 3 principles. Is psychoeducation about stress, acquisition of coping skills, practice and generalization in everyday life. 8. Training in problem solving. Today, our social and personal scenarios have become more and more complex. Therefore, being able to solve problems is a core competence. Cognitive behavioral therapy places special emphasis on this area. The psychotherapist guides the client in the following steps. Discovery of everyday challenges and problems. Understanding the reasons. Think of different strategies to solve these problems. Access the most appropriate actions and decision-making strategies. Regulation of stress and fear. Checking the results. 9. Mastering self-control. Techniques for cognitive behavioral therapy. Self-control allows us to act more judiciously and feel in control of our lives. Few resources are as necessary in mental health as providing clients with good self-control. Thanks to this psychological competence, the client achieves the following. Reduced impulsivity, better regulated emotions, more consistent decisions, fostering interrelational connections. 10. Operant techniques for changing behavior. Operant strategies for changing behavior are important techniques of cognitive behavioral therapy. Indeed, in psychotherapeutic contexts it is important to establish healthier behaviors and limit those that are dysfunctional or harmful. For this purpose, strategies that have their origins in behavioral psychology are carried out. They are as follows. Punishment, extinction, saturation, time out, overcorrection, differential gain, positive or negative reinforcements. 11. Relaxation, breathing techniques. In recent years, cognitive behavioral therapy has integrated mindfulness techniques into its methodology. This ancient practice includes some beneficial tools. In fact, breathing, relaxation, and mindfulness are sufficient resources to relieve many types of symptoms. A study published in the Indian Journal of Psychological Medicine states that CBT using mindfulness is effective in clients who have anxiety disorders. 12. The upward arrow technique. With the upward arrow, the cognitive behavioral psychologist finds the roots of the client's dysfunctional thoughts. The therapist asks a series of questions, with which he or she deduces the triggering cause. In turn, the client becomes aware of the mechanisms that build his or her discomfort and a rational cognitive approach. 13. Goal-setting technique. As CBT aims to train the client in clarifying and establishing goals. After all, people need motivators in their daily routine to make progress, feel useful and stay active. To train a person in this type of tool, the following series of guidelines are followed. Clarify his or her dreams and passions. Define objectives. Set SMART goals, specific, measurable, achievable, relevant, and time-bound. Break these goals down into smaller steps. Think about the steps and mechanisms of action. Stay motivated. Follow up and evaluate the results, advantages and limitations of cognitive behavioral therapy techniques. An article titled "The Key Principles of Cognitive Behavioral Therapy" alludes to the main benefit of cognitive behavioral therapy techniques. These are strategies that have a lasting and positive effect on clients. However, when it comes to their limitations, it should be noted that these resources only seek to solve current problems. This means that CBT does not address the client's past and the root of the problem is not always addressed. But the client is empowered so that he or she can take greater control of his or her own life by taking care of his or her mental state. It is a fantastic starting point for ensuring the client's psychological well-being.